Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in today's session, we are going to deal with a new topic, which is the hospital-acquired infection. This hospital-acquired infection is also known as the nosocomial infection. And here, the client who is present in the healthcare setting are at a higher risk of developing this infection. This nosocomial infection results from the delivery of the health services in the healthcare setting, and here a hospital is one of the most common place for one to likely acquire this nosocomial infection. This word nosocomial was derived from a Greek word nosokomion, which means hospital. And also here, when we break this word into two, the noso means disease and the comio means to take care of. So now let's move on to the definition of this nosocomial infection, or we can also say the hospital-acquired infection. So here, nosocomial infection is defined as an infection which occurs as a result of the treatment which was provided to the patient in the hospital. However, this is just secondary to the original condition of the patient. These infections are considered nosocomial if they appear 48 hours or more after the patient is being admitted to the hospital, or even within 30 days of them being discharged from the hospital. So here, if any patient acquire any infection that first appear 48 hours or more after he has been admitted in the hospital, or even within the 30 days of him being discharged from the hospital, then this infection is known as the nosocomial infection. And this is mainly because of the treatment which was provided to the patient during his stay in the hospital. But this is just secondary to the patient's original disease condition. This type of infection is commonly known as the hospital-acquired infection, or more generically, healthcare-associated infection. So here, the most common nosocomial infection that a patient may acquire during their stay in hospital are as follows. It can be the ventilator-associated pneumonia, methicillin-resistant, Pseudomonas aeruginosa, Acinetobacter baumannii, Streptophomonas maltophilia. The most common nosocomial infection that the patient can acquire during their hospital stay include tuberculosis, urinary tract infection, hospital-acquired pneumonia, as well as gastroenteritis. This nosocomial infection is also of three types. The first one is the iatrogenic, the second is the exogenous, and the third is the endogenous. This iatrogenic is a type of nosocomial infection that results from any diagnostic or therapeutic procedure which was performed for the patient. For example, a patient may acquire urinary tract infection due to catheterization. So here, this iatrogenic is a type of nosocomial infection which a client will be acquiring from any diagnostic or therapeutic procedure which was performed for them. And the second one is the exogenous. This is a nosocomial infection which arises from the microorganism external to the individual which do not exist as a normal flora. And the most common example for this is the Clostridium tetani. And the third one, which is the endogenous infection, this can occur when a part of the client's flora becomes altered, and this can lead to an overgrowth result. So here, the most common example for this is any infection which can be caused due to enterococci, due to yeast, etc. So these are the three types of nosocomial infection. Now, what are the causes of this infection? Since we know that hospital is a place which consists of large number of people who are sick, or even of those who have a weakened immune system. So because of this, one can easily acquire this nosocomial infection. And since the medical staff are the people who are responsible for providing care for each and every client, so here, when they move from patient to patient, they provide a way for these pathogens to spread. Many medical procedures which is also performed for the patient bypass the body natural protective barriers. So this can easily lead them to suffer from various type of nosocomial infection. The routine use of antimicrobial agents in the hospital creates a selective pressure for the emergence of the resistant strain. So these are the various causes of nosocomial infection. So since we have discussed about the types as well as the causes, now let us discuss about how can these nosocomial infection transmit from one person to the other, or how can the patient acquire this nosocomial infection during their hospital stay. So here there are various routes of transmission. The first one is the contact transmission. The second is the droplet transmission. The third is the airborne transmission. The fourth is the vehicle transmission, and the fifth one is the vector-borne transmission. So in order to get a detailed idea of how these infections can transfer through these various routes, let us look at each one of it in detail. The first one is the contact transmission. So this is a frequent mode of transmission and is further divided into two subgroups. The first one is the direct transmission and the second is the indirect transmission. So what do you mean by direct transmission? So this direct transmission is the process of transmission whereby these pathogens can be transmitted from an infected person to the host through direct contact. For example, it can be transmitted through the physical activity, through handshake, or even if you touch the body of that particular infected person. And the second subgroup, which is the indirect transmission, this is the process whereby these pathogens will be transmitted from the infected person to the host through various objects, through various articles, through various equipments or instruments which they use. For example, when a medical staff is providing care to that infected person, if the needles which she had used for that infected person, the gloves which she had wore while she was providing care to this person, if she does not discard it but she takes the same needle and she wears the same gloves when she is providing care to the other healthy person as well, then this can transmit the pathogens from that infected person to the other healthy person. So that is why this contact transmission is the most frequently mode of transmission. And here, if there is a direct contact between the host and the infected person, then this is known to be the direct transmission. Whereas if there is no direct contact between the host and the infected person, and these pathogens are transmitted between these two through various objects, through various articles, through various instruments, then this is known as the indirect transmission. And the second one is the droplet transmission. So this is the process of transmission whereby these pathogens will be transmitted from the infected person through the host by the droplets, especially when they are coughing, sneezing, or even talking to the host. And the third one is the airborne transmission. So this occurs by dissemination of either the airborne droplet nuclei of evaporated droplets that contain these microorganisms that will remain suspended in the air for a long period of time, or in the dust particles containing these infectious agents. So as I've said that this droplet transmission is the process whereby the pathogens will be transmitted through the droplets of that infected person when they are coughing, sneezing, or even talking. Whereas this airborne transmission is the process of transmission whereby these microorganisms will be suspended in the air, and when one inhales this air, then it can also lead them to suffer from various infectious diseases. And the fourth one is the vehicle transmission. So this is the process of transmission whereby these microorganisms will be transmitted from the infected person, medications, certain devices, as well as equipments. So here, whenever these microorganisms are transmitted from one person to the other through various objects, through various instruments, through various articles, then this is known as the vehicle transmission. And the last one, which is the vector-borne transmission, is the process whereby these microorganisms or these pathogens will be transmitted to the host through vectors such as mosquito, flies, rats, etc. So these are the 5 routes through which these microorganisms can be transmitted from an infected person to the host. So how can we control this hospital-acquired infection or the nosocomial infection? Here, each and every hospital must have an infection control team which consists of the microbiologist, medical and the nursing staff, as well as the hospital administrator. This team will be responsible for conducting various infection control programs as well as to educate the other healthcare professionals on what are the various practices they should follow in order to prevent this spread of infection within the hospital. Besides this investigating as well as controlling the outbreak, there are also various functions which include formulating the appropriate guidelines for admission, nursing, as well as for the treatment of the infected patient, surveillance on sterilization, as well as disinfection practices. So here it is their function to formulate the appropriate guidelines for admission, for nursing, as well as for the treatment which must be provided to these infected people, as well as surveillance on the sterilization and disinfection practices must be done. They must also determine the antibiotic policy as well as the immunization schedule. They should educate the patient, the family members, the visitors, as well as the healthcare professionals on the infection control practices. Although here we cannot eliminate this infection from occurring, but if we adopt these measures, then it can reduce this nosocomial infection or the hospital infection from occurring. So this is how we can control this infection. Now moving on to the next, that is prevention. So how can we prevent this nosocomial infection from occurring? We can do it by various methods. The first one is the isolation. So here, isolation precautions are specially designed in order to prevent this transmission of microorganisms through the common routes in the hospital. So here what we are going to do is we are going to isolate the patient who is infected so that he or she may not pass on this infection to the host, right? So here whenever one is being infected, we should make sure that we isolate them from the rest so that this transmission of infection will be interrupted. The next one is hand washing and gloving. So here it is very important that we must always wash our hands before and after we perform any procedure, as well as we must advise the patient, the family members, and also the visitors that they must always wash their hands before, after food, as well as after they have used the washroom or has touched any of the equipments or materials which is present in the hospital. Because this is one of the most important measures that everybody must follow in order to prevent the spread of the microorganism. Here, especially when we talk about us, the medical professionals, washing hands thoroughly and promptly, as much as possible between the patient contact and after contact with blood, body fluids, secretion, excretion, and any equipments or articles which is contaminated by them is an important component of the infection control and the isolation precaution. Here, although hand washing may seem as a simple process, it is often performed incorrectly. So here in the healthcare setting, we must make sure that we must remind the practitioners as well as the visitors of how to perform the proper hand washing, on the proper procedure which they must follow whenever they wash their hands, because in this manner it will reduce the spread of infection. So here in a healthcare setting, it is not necessary that only the medical professionals must wash their hands or must wear gloves whenever they are in contact with the body fluid, with the secretions, with the discharge of that infected patient. But here we must also make sure that we also educate the visitors, the family members, as well as the other practitioners on the proper procedure of washing the hands and why is it important to wear the gloves whenever we touch the body secretions, the discharge, or even the excretions of the infected person. In addition to hand washing, wearing of gloves also plays an important role in reducing the spread of these microorganisms. So in a hospital, gloves are mainly worn for three important reasons. The first being, firstly, here the gloves are worn in order to provide a protective barrier and to prevent the gross contamination of the hands when touching the blood, the body fluids, the secretion, the excretion, the discharge, the mucous membrane, as well as the non-intact skin of the infected patient. Here, the wearing of gloves in specified circumstances also helps to reduce the risk of exposure to certain blood-borne pathogens. Secondly, these gloves are worn in order to reduce the likelihood that these microorganisms present on the hands of the person will be transmitted to the other patients during any procedure or whenever he or she is performing any invasive that involves touching the patient non-intact skin as well as the mucous membrane. And thirdly, these gloves are worn in order to reduce the likelihood that hands of personnel contaminated with these microorganisms from a patient to a fomite can transmit these microorganisms from one person to the other. So in this type of situation, what we can do is that we can change the gloves between the patient contact, as well as we must perform thorough hand washing after the gloves are removed. Here, it is very important to remember that wearing gloves does not mean that you should not perform hand washing anymore, or it does not mean that your hands will not be infected, because these gloves may have small, non-apparent defects or can even be torn when they are in use, as well as the hands can become contaminated while we are taking off the gloves. That is why it is very important to remember that no matter if you wear a gloves or not, when you are providing care, you must always perform the hand washing before and after you have wore the gloves. The next method is by wearing an apron. Here, whenever you wear an apron while you are providing care to the patient, it helps to reduce the risk of infection. However, this apron should either be disposable, or if it is reusable, then we must make sure that we use that apron only when we are providing care for that particular patient. And the last one is mitigation. So here, the most effective way of controlling this nosocomial infection is to strategically implementing the quality assurance or the quality control measures to the healthcare sectors. And here, the most feasible approach is the evidence-based management. So these are the various ways through which you can prevent the nosocomial infection from occurring. So now here we've come to the end of this topic. So in today's session, we have discussed in detail about what do we mean by nosocomial infection, what are the two types of nosocomial infection, what are the causes, as well as how can we control these infections, and also how can we prevent this nosocomial infection from occurring. So I hope you have got a clear understanding of this topic. I'll be meeting you in another session. Until then, have a good day. Thank you.